Welcome to Holistic Oasis, your go-to channel for mastering medicine while caring for both body and mind. I'm Dr. Ahmed Hawash, lecturer and consultant of critical care from Alexandria University, Egypt, and today, we're diving into the 2024 ESC and AHA guidelines on heart failure, a must-know topic for medical students and residents. If you're passionate about improving lives through holistic healing and cutting-edge medicine, hit the subscribe button now and turn on notifications. Let's get started. Heart failure is a serious condition. It affects millions worldwide. This condition is not just a medical issue, but a significant public health challenge that requires urgent attention and action from both healthcare professionals and the general public. This video will explain heart failure in simple terms. We aim to break down complex medical jargon into understandable language so that everyone can grasp the severity and implications of this condition. We will explore its causes, symptoms, diagnosis, and treatment. By understanding these aspects, we can better equip ourselves to recognize early signs and seek timely medical intervention. Understanding heart failure is crucial for medical professionals and the public alike. Knowledge empowers us to take preventive measures and make informed decisions about our health. Heart failure occurs when the heart can't pump blood effectively. This inefficiency means that the heart is unable to meet the body's needs for blood and oxygen, leading to various health complications. This leads to a shortage of oxygen and nutrients in the body. When organs and tissues don't receive enough oxygen and nutrients, they can't function properly, which can result in fatigue, shortness of breath, and other serious symptoms. It's a major public health issue. The impact of heart failure extends beyond individual patients, affecting families, communities, and healthcare systems globally. Heart failure affects over 64 million people globally. This staggering number highlights the widespread nature of the condition and the urgent need for effective management and prevention strategies. The prevalence of heart failure is rising. Factors such as an aging population and the increasing incidence of risk factors like hypertension and diabetes contribute to this trend. This is due to aging populations and lifestyle factors. As people live longer, the likelihood of developing heart failure increases, especially if they have other underlying health conditions. These factors include poor diet and lack of exercise. Unhealthy eating habits and a sedentary lifestyle are significant contributors to the development of heart disease and heart failure. Heart failure significantly impacts healthcare systems. The condition leads to frequent hospitalizations which strain medical resources and increase the workload for healthcare providers. It results in frequent hospitalizations and high healthcare costs. Managing heart failure is expensive, involving costs for hospital stays, medications, and ongoing medical care. Early detection and management are vital. They improve patient outcomes. Identifying heart failure in its early stages allows for timely intervention, which can slow the progression of the disease and enhance the quality of life for patients. They also reduce the burden on healthcare systems. Effective management strategies can lead to fewer hospital readmissions and lower healthcare costs, benefiting both patients and healthcare providers. By understanding heart failure, we can strive for better prevention, diagnosis, and treatment. Ongoing research and public health initiatives are essential to combat this condition and improve outcomes for millions of people worldwide. Heart failure is not a complete stop of the heart. It means the heart is struggling to pump blood. Imagine a pump that can't keep up with demand. That's what happens in heart failure. The heart, a powerful muscle, pumps blood to the body. This blood carries oxygen and nutrients. In heart failure, the heart muscle weakens. It cannot pump blood effectively. This leads to fatigue, shortness of breath, and fluid buildup. This condition can affect people of all ages. However, it's more common in older adults. Various factors contribute to heart failure. These include high blood pressure, coronary artery disease, and diabetes. Understanding the basics of heart failure is crucial. It helps in early diagnosis and effective management. Heart failure is categorized into different types, each with its own characteristics and implications for treatment. This categorization is primarily based on a measurement known as ejection fraction. Ejection fraction refers to the percentage of blood that the heart pumps out with each beat, a critical indicator of heart function. One type of heart failure is known as heart failure with reduced ejection fraction, or HFrEF. In HFrEF, the heart muscle is weakened and cannot contract effectively. As a result, it cannot pump out enough blood to meet the body's needs. This condition is also referred to as systolic heart failure, highlighting the issue with the heart's pumping action. Another type of heart failure is heart failure with preserved ejection fraction, or HFpEF. In HFpEF, the heart pumps out a normal amount of blood with each beat. However, the heart muscle is stiff and less flexible. This stiffness means the heart cannot relax properly and fill with blood during the resting phase between beats. This condition is also known as diastolic heart failure, emphasizing the problem with the heart's filling phase. Understanding the specific type of heart failure a patient has is crucial for effective management. It allows doctors to tailor treatment plans that address the unique needs of each condition. These treatment plans often include a combination of lifestyle changes such as diet and exercise, and medications to help manage symptoms and improve heart function. In some cases, patients may also benefit from cardiac rehabilitation programs and regular monitoring to track their progress and adjust treatments as needed. With the right approach, many patients with heart failure can lead active, fulfilling lives despite their condition. Heart failure usually develops over time. It is often due to other health conditions. These conditions damage the heart muscle. One common cause is coronary artery disease. This is when the arteries that supply blood to the heart narrow. This can weaken the heart muscle over time. High blood pressure is another major contributor. The heart has to work harder to pump blood. This can strain the heart and lead to failure. Other factors include diabetes, obesity, and smoking. These conditions can damage blood vessels and the heart muscle. Understanding the causes of heart failure is crucial for prevention. By controlling risk factors, we can reduce the chances of developing this condition. Recognizing the symptoms when the heart falters. Heart failure symptoms can vary. They also develop gradually over time. Early recognition is vital for timely intervention. Shortness of breath is a common symptom. It can occur during activity or even at rest. This happens because the heart cannot pump enough blood to meet the body's needs. Fatigue and weakness are also frequent complaints. The body is not receiving enough oxygen-rich blood. This leads to tiredness and a lack of energy. Other symptoms include swelling in the legs, ankles, and feet. This is due to fluid retention. Fluid builds up because the heart cannot pump it effectively. It's essential to recognize these symptoms. Early detection and treatment improve outcomes. Diagnosing heart failure. Listening to the clues. Diagnosing heart failure involves a series of tests. These tests assess the heart's function and structure. A physical exam is the first step. Doctors listen to the heart and lungs for abnormalities. They also check for fluid retention. An echocardiogram is a crucial test. It uses sound waves to create images of the heart. This helps doctors evaluate the heart's pumping ability and valve function. Other tests include an electrocardiogram, chest X-ray, and blood tests. These tests provide additional information about the heart's health. Prompt diagnosis is vital for initiating appropriate treatment. Early intervention can slow down the progression of heart failure. Lifestyle modifications. Taking charge of your heart. Health. Lifestyle changes are essential for managing heart failure. These changes help improve heart health and reduce symptoms. A heart-healthy diet is crucial. This includes reducing salt intake, limiting saturated and trans fats, and eating plenty of fruits, vegetables, and whole grains. Regular physical activity is also important. Aim for at least 30 minutes of moderate intensity exercise most days of the week. However, it's crucial to consult with a doctor before starting any exercise program. Other lifestyle modifications include quitting smoking, managing stress, and getting enough sleep. These changes can significantly impact heart health. By adopting a healthy lifestyle, patients can take an active role in managing their condition. Medications. Supporting the failing heart. Medications play a crucial role in treating heart failure. They help control symptoms, improve heart function, and reduce the risk of complications. ACE inhibitors and ARBs are commonly prescribed. They relax blood vessels and make it easier for the heart to pump blood. Beta blockers slow the heart rate and reduce blood pressure. This gives the heart a chance to rest and recover. Diuretics help remove excess fluid from the body. This relieves symptoms like swelling and shortness of breath. It's important to note that medications should only be taken under the guidance of a healthcare professional. Case study. Putting knowledge into practice. A 65-year-old man presents with shortness of breath and fatigue. He describes these symptoms as progressively worsening over the past few weeks, making it difficult for him to perform daily activities. He has a history of high blood pressure and diabetes, both of which have been poorly controlled despite medication. His blood pressure readings at home have been consistently high, and his blood sugar levels fluctuate widely. He is a former smoker, having quit 5 years ago after a 30-year history of smoking a pack a day. Despite quitting, the long-term effects of smoking have likely contributed to his current condition. On examination, he has swelling in his legs and ankles, which he reports has been present for the last month. This swelling, or edema, is a common sign of heart failure and indicates fluid retention. An echocardiogram reveals a reduced ejection fraction, indicating that his heart is not pumping blood as effectively as it should. This finding is critical in diagnosing heart failure. This case highlights the importance of recognizing risk factors and symptoms early. High blood pressure, diabetes, and a history of smoking are significant contributors to heart disease. The patient's history and examination findings suggest heart failure. His symptoms, combined with the physical signs and echocardiogram results, point towards this diagnosis. The echocardiogram confirms the diagnosis, showing that the heart's ability to pump blood is significantly impaired. This imaging is crucial for assessing the severity of heart failure. This case emphasizes the need for early diagnosis and treatment. Early intervention can slow the progression of heart failure and improve the patient's quality of life. By addressing risk factors and managing symptoms, we can improve outcomes for heart failure patients. Lifestyle changes, such as a healthy diet, regular exercise, and medication adherence, are essential. Remember, this case study is for illustrative purposes only. It is designed to highlight the importance of comprehensive patient care and the need for ongoing medical evaluation. Always consult with a qualified healthcare professional for diagnosis and treatment. Each patient situation is unique, and personalized care is crucial for effective management. Thank you for watching. If you found this video valuable, don't forget to like and share it with your colleagues. And remember to subscribe to Holistic Oasis for more insights into modern medicine that empower your journey as a healer. See you in the next video. Stay curious, stay compassionate.